Now, this is a very interesting CT scan of the chest. This is HRCT, high resolution CT scan of the chest. So, what we can see in this HRCT is when we zoom in, this is obviously left side, this is right side. When we zoom in, we can see on this right upper lung field, we can see these very clear lesion here, here, and here, as well as here it can be traced. So we know that whenever there is a dense white fiber-like or line-like lesions in the lungs, it is usually always fibrotic bands. So we can see that this is very much hyperdense, white, and this is coming from the lateral part of the chest, which is not here at all. Here it is perfectly normal or okay, but here we have dense white fiber-like connections or lesion. This typically suggests fibrosis because whenever there is infection or damage, there is inflammation, and this inflammation either completely recovers, completely gets better, or it heals with fibrosis. And fibrotic bands are always dense white lining like lesions. So here this is very, very typical of fibrotic bands. What we can see here is we have fibrosis, which is here, which is obvious, and we also have one round cavity. This is cavity just like trachea. So this is a cavity. So what we call it as is a fibrocavitary lesion because we have fibrosis here and we have a cavity here. So this is a fibrocavitary lesion, and which is very, very, very commonly seen post tuberculosis or post staphylococcus aureus lesion infection, and very commonly it is seen in immunocompromised patients, especially diabetic patients who are uncontrolled diabetic, cancer patients, or those patients who are on chemotherapy, or smoker patients, or elderly patients with so much of malnourishment. So in this image, we can very nicely make out that this is not only a fibrocavitary lesion, this is cavity, but it also has some lesion inside the cavity, and this is a ball-like lesion. So this is typical fungal ball lesion, and this is almost very commonly found, and it is almost always a fungal ball, and most of the time this fungal ball is because of this aspergillosis. This aspergillosis is very common in those patients who have diabetes, who have immunocompromised status, who are on chemotherapy, who had an earlier history of tuberculosis which caused the cavity, or staphylococcus aureus infection which caused cavity, and later it gets secondarily infected by the fungus, and this fungus then invade here. Patient can very commonly present with cough, fever, weakness, loss of energy, chills that may last for a month or 2 or 3 as well, and then present to you. Then you do CT scan and you can find the structure. So this is a typical fibrocavitary lesion with fungal wall, which is very highly selective or very highly suggestive of aspergilloma. We can simply do the sputum test for aspergillosis. We can send serum galactomannan test, though serum galactomannan test is not very specific because very commonly used medicines like Tazar or penicillin groups or carbapenem antibiotics, they can also give this serum galactomannan test as a false positive. So that is not very accurate test for aspergilloma, but negative test can tell us that the chances of having aspergillosis can be much, much lesser. And this aspergillosis or fungal ball is very effectively treated with voriconazole. So this comes in injection as well as tablet form. So injection, usually in most of the patients, the dose is 200 milligram IVBD, that is given for around 10 days. It may be given for more days also, or very commonly per orally tablet. This is given 200 milligram twice a day for around 14 to 21 days, depending on the response to the patient. If the patient shows excellent response, 21 to 30 days medicine can be given. It can be continued up to 2 to 3 months as well if the response is inadequate, but most of the time it is given for around 21 days to 30 days. So this is very, very typical of a fibrocavitary lesion, highly suggestive of aspergilloma, which can be investigated or diagnosed on the basis of sputum or bronchoscopic aspergillus test examination, serum galactomannan, typical symptoms, and treatment with voriconazole, which is excellent drug for this. And most of the time, voriconazole treats all these patients. So, thank you.